session, we would like to welcome our next charismatic and respected speaker, Dr. Sudha Ramalingam ma'am, unparalleled expertise in research to ignite us with her ideas. We would also like to welcome the chairpersons of the session, respected Dr. Anita ma'am, Vice Principal and Professor of Physiology, Chengalpet Medical College, Sparkling MU Coordinator, Resource Faculty, and Reviewer to introduce the speaker. We have also one more chairperson, sir, respected Dr. Muthuselvan, sir, former passionate Dean KMC, former Additional Director of Medical Education, and former Chairman of Selection Committee. We welcome you, ma'am, and we welcome you, sir, for the session.
With best wishes to DEEPAM Medicom, we are honored to introduce Dr. Sudha Ramalingam ma'am, who is going to present next. She is as a director of PhD FAIMER Regional Institute and also as a research and professor heading the Department of Community Medicine in PSG with a total years of experience of 17 years in teaching and in research with a publication of 72 and accolades and awards for her Best Teacher and Motivator Award. Can the audience applaud for this? Institute Award for Excellence in Medical Education. Yes, sir. Purani Oration Award, Dr. Rajamal Devadas Oration Award, Best Researchers Award by TNMGR Medical University. I think the list never ends, but Madam has magnanimously reduced the awards and list of it. Over to sir to add on further feathers to Madam's
Good afternoon, everyone. It's always a privilege to listen to Dr. Sudha Ramalingam Madam's speech. I had the privilege of listening to her. It was a wonderful lecture at international conference, and her topic is a wonderful topic: fostering leadership for change management in medical education. Managing ourselves according to the change is the main crux of it. So, for a leader like Dr. Sudha Ramalingam, so it will be a eye-opener for each one of us. Over to Madam to proceed on. Welcome, Madam.
Okay. So, very good afternoon, one and all. Or should I say good night? Post-lunch, especially, I see a lot of empty chairs, but whoever is here, I'm sure you're all motivated to listen to what I'm going to say. And many of you are leaders in your own sense, so I don't have to say anything new, just that I'm going to reiterate what you already know. Probably those who are in FAIMER, who have undergone FAIMER fellowship would already know some of the points which I'm going to talk about today. So how many of you think leadership is easy? I think I see many leaders. All of us are leaders in our own sense. How many of you think leadership is easy? Yes. Any thoughts? Everybody is smiling, so nobody wants to take any sides. So we all know how leadership is difficult, especially as educators. We are leaders in our own sense, especially after CBME, we have been facing so many challenges. So how we are going to manage this change, how we are going to document, how we are going to introduce something new, so on and so forth. So the objectives of this session is going to be, mostly focused on change management. The slide is not moving. So let us manage technology first. Yeah. Slide is not moving. So I want to touch upon what is change management and what are the skills a leader should possess for managing any change within our, and understand the steps for sustaining change. It's not enough if you just change. but you have to sustain the change because, we have long-term, impact and effectiveness of change. Right, I'm going to change the mic now. So if you want to make enemies, try to change something. All of us can relate to it. As head of the departments or head of the institutions, or even your own class, as a teacher, you want to change something. Ask the students to come by like 8 o'clock, right? So you make a lot of enemies. Ask the students not to use mobile in the class. Again, we make a lot of enemies. So any change comes with a lot of, criticisms and issues. But nevertheless, we are all here gathered as educators for one common purpose, to navigate the change management and how we can foster effective leadership among ourselves and within our, team to effectively manage change. So what is change? Organizational change refers to, it's an entity to change or adjust to significant component of organization. It can be big, or it can be the company culture, it can be internal processes, underlying technology, corporate hierarchy, any other critical aspect can be a change. So including like, NMC punching. When it came, we all had difficulty, how to punch, how to record our attendance. Already we are recording attendance with our own colleges. So now we have biometrics. Then they said phone. Like, the change keeps coming, but we adapt ourselves to these changes. So what can be a change? Changes can be a small adaptive change, like it can be small, gradual, iterative changes that an organization undertake to evolve its products, processes, workflows, or strategies over time. For example, hiring a new team member to address increased demand or implementing a new timing. So there is somebody who's going to stand near the attendance register or the biometric attendance to monitor whether you're punching on time. So that could be a small change. I mean, nobody's going to do that. I'm just giving you an example. And transformational changes are larger, especially like, if there is a new department you want to start, or you want to start a new administrative processes. There is a new hierarchy, new organogram. And of course, we all are in the common space when we talk about CBME. So why change? As we all know, change is the only constant. So if there is no change, the education will not evolve, the system will not evolve, the healthcare will not evolve. So change is a must, and it is inevitable, and it is necessary. So if you look at it, like, we were talking yesterday about the different generations of students. So now we are catering to Gen Z. Soon we'll be catering to Gen Alpha. But the nightmare is Gen Z will become faculty. Sorry, Gen Z, whoever, if you're here. So you all will become faculty. And our responsibility will be to mentor the Gen Z faculty and also teach the Gen Alpha. Imagine our situation. So we need to be at par with what they are doing. We need to be at par with the fast pace at which they are adapting to technology, right? So change is inevitable because information is at our fingertips. So you don't need a teacher. When you say like, why should I learn? Why should I attend your class? We need to have a very good answer why they need us in the class. So for that, we need to be updated every day, not just with technology, but also the newer topics. Especially before COVID, none of us knew whether there was COVID-19 or not. Probably we read it in microbiology textbooks in one corner, coronavirus. But we didn't know what COVID-19 was. We didn't know what was the incubation period. We didn't know what was the prevention strategies, but we learned. So there is change every day. The disease patterns change. So we need to keep pace with what is happening around us. So I just read that President Donald Trump, the US is exiting the UN. So that is a change because it is going to impact the larger geopolitics and effectively the public health ecosystem. So every day we need to look at the change and adapt ourselves. So practice shifts. So evolution of medical practice also changed because the patients, instead of relying on the doctors, now rely on whom? Whom do they rely on? AI. They rely on ChatGPT. They rely on Google. Google has become outdated now, I think. Google God has become outdated. So now in the US, there is a new software. I think some evidence, something my friends had shared, but it is not there in our country yet. But patients can look up symptoms, treatment, differential diagnosis, and whatnot. So the practice system has changed. So how are we going to train the next generation of doctors for adapting to these changes? Again, next, the pedagogical models. So a lot of innovations have come. We have been seeing since morning. Dr. Krupakaran wonderfully narrated the different gamification methods. It was a wonderful insight into different technologies. How are we going to adapt to it? How are we going to, read? How are we going to train ourselves, our teachers, our students? So change is inevitable. And each of us are leaders, and each of us will lead these changes in whatever capacity we are in. So it is important for us to know how we will manage this change. So when I talk about change management, it doesn't mean the institution is going to change. We are not going to rebuild the whole, this auditorium. Probably this has stood this, different decades of times. So this auditorium has been there for long, but only the people change. So when I talk about change management, I'm not talking about, building a palatial building or big infrastructure. I'm talking about people who are working there. So it is defined as a structured and methodological process for managing the people side of change. So whenever I talk about change management, I am talking only about the people. As I'm sure in the government sector, you all have witnessed the regular transfers. Probably a person who was a dean in this college last 6 months back, now is a dean in some other college. Again, if you're an organizing person, I think a key organizing person from this college has been transferred to some other college. So like that, the change happens. And how we adapt to this change is very important. So that is what I'm talking about when I say change management. So the different models of change management. As a community medicine person, we are very fond of definitions and models, but I'm not standing here as a community medicine faculty, but as an educator. There are 3 different models which we can talk when we talk about change management. First is the Cotter's 8-step model, which we will look at it a little more in detail. And then we have the other ADKAR model, which stands for awareness, desire, knowledge, ability, and reinforcement. So this focuses more on individual, not as a whole, as a system, but this focuses on the individual change. And Lewin's change management model is very simple. It says unfreeze, change, refreeze. If we want to change a record book, dismantle it, introduce a new record book, and freeze it. Right? It's just 3-step model. Again, it's a simpler and which will be useful for smaller changes, but not for an organizational change or a system change. So today we'll just talk about Porter's 8-step model. I'm going to introduce you to different steps or different terminologies here. Please bear with me. If you know it already, please think of it as a recap. If you don't know, please, probably you get oriented to these systems or a way of looking at things when you talk about change management. The Cotter's 8-step model, which says, first and foremost, create a sense of urgency. When CBME was introduced, there was a sense of urgency, which was given by the then Medical Council of India, which released a document, GMER, and then they released the, different training modules. The BCME, earlier it was called in a different name, and then there was ACME, and then now it became CISP. So the sense of urgency. So where all of us got trained repeatedly. Basic workshop, medical education workshop, and then there was revised basic workshop. And then we had so many workshops to empower ourselves. So there was a sense of urgency. So that was what was created across the country, across the institutions. That is a first step. And second, build a guiding coalition. You can't do it alone. You have to build a team. If I have to bring in a change in my institution in the way they assess, I cannot do it alone. I have to gather people who are knowledgeable about it, who have keen interest in what I'm doing, and who have some kind of stake at what is happening. So we have to build a coalition or a team, and then form a strategic vision. It is not enough if you form a team. You have to say what you are envisioning at the end of 6 months or a year or a few years later, what you want them to do. So that is creating the right climate. So first set the stage. Next step will be engage and enable others, where I will enlist the volunteer army. I will enable action by removing barriers. So I know what are the barriers. If I want to introduce a portfolio, e-portfolio in my department, I know what are the barriers. So I have to overcome it. I have to train the faculty. I have to create a conducive research, ecosystem, like, give them the appropriate technology to make it simpler. And then generate easy wins so that they feel fulfilled, they feel happy. Yes, it is working, right? That is engage and enable others. And third is implement and sustain. So you have to then increase the pace and institute the change. So this is the quarters 8-step model, which we try to follow when we want to introduce some change. So same thing. I'll give you an example. This article talks very well about how an institute or department in the University of Michigan brought in about residence didactics. So they wanted to change. So how they brought about it using this quarters 8-step model. This is the reference. So you can go through it. It's a it's an open access journal. So you can go through it at your leisure. So why do you think change is difficult? Have you tried any change in your institution? Anyone? I know it's post-lunch. So for me also, it's like I'm also sleepy. If I don't have to sleep, please answer. Otherwise, I'll stand and sleep. Yes? Yes. What change? Why change is not happening? Can you get a mic?
We are planned for OMR correction and government medical college
Yes.
Krishnagiri. So 20 questions. There is an app, Evolve app. In the app, we can give MCQ answers. The
Right.
corrections will be very easy. The scanning of sheet will give the marks, ma'am. It's going on nicely there now.
Yeah. So did you face any challenges? Were you able to implement this change? If not, why?
Ma'am,
One word is fine. Just one reason why you were not able to implement this change. Was it successful or is it still work in progress?
no, ma'am. It's successful. The
Successful.
department we have implemented
Good.
successfully.
What contributed to the success?
All of
Ma'am, the ease of the work,
Wonderful.
it made the correction of MCQs. Within 5 minutes, we would correct the 150 students.
Yes.
So before the student finishes the theory exam and comes out, we would have the MCQs mark ready for the students.
Okay.
So that was the reason. The ease of doing the things made this very successful.
So aligning with Gen Z, there is instant gratification.
Yes.
They go in and come out with the marks.
Yeah.
Wonderful.
Yeah.
Yes. So anything else? Any challenges you face when you do the change?
Raja from Bangalore.
Yes, sir.
I think people don't want to come out of their comfort zone.
Absolutely.
They don't want
Yes.
to take chances.
So one is the teachers or even students don't want to come out of their comfort zones. Wonderful. So there are a lot of experience we all have. And some of the reasons is institute is not prepared. So we want biometrics, but we don't have Wi-Fi. NMC says biometric, but we don't have Wi-Fi. So how to do that? Go about it, right? That is a challenge. So institution is not ready. Faculty are not ready. As sir said, we all want to be in our comfort zones. We don't want to come out. We feel it threatened. Our comfort zone is threatened. So we don't want to come out of it. Or maybe we feel like we are not ready. If you want me to do a CBME curriculum of introduction 5 years back, I wouldn't have done it because we are not ready. We are not ready. If you ask workplace-based assessment or any further forms of assessment, we're not fully equipped to do it across any colleges, right? So faculty are not ready. Poor vision and lack of communication of vision. Resistance. Some of the faculty or even students, they don't want to change, even though they can change, but they don't want to change. Fear to change. And happy with small wins. I'm happy with one chocolate which I get instead of a big chocolate factory which I can build, right? So happy with small wins. So these are all like common human traits which can hinder any change. So reality, what happens is, who wants to change? Who wants a change? When I say who wants a change, everybody will lift their hands. Yes, I want change. Who wants to change? Are you ready to change? No. all of us will be quiet because of the reasons which I mentioned earlier. Who wants to lead the change, everybody will disappear. Right? I'm sure all of us who are here leading something or the other would say the same thing. Who wants to lead the change? Oh, no. Right? So this is the reality. But who wants to lead the change? You and me. We are all here as change agents. We are all here gathered post-lunch on a weekend, long weekend, that too, right? Saturday, Sunday, Monday. 3 days we have holiday, which is a like precious commodity in our profession. But we are all here assembled post-lunch. Gives just one reason, one cause, because we are all interested in the education. We are all interested in providing quality education for the next generation of doctors. Probably might be a selfish reason, because when we got old or sick, we are going to go to them. So we better train them well. Like people at my age and stature, we think, oh, okay, if I get older, I need to go to this person. So let me train him well. There is a selfish motive inside, right? So nevertheless, you and me are the change agents. So who are the change agents? We cannot, I can't call somebody and say, hello, I'm a change agent. Doesn't work that way. So change agent is somebody who can alter human capability or organizational systems to achieve a higher degree of output or self-actualization. So we are the leaders. We want to lead the change, and we are the change agents. All of us are working towards that in some capacity or the other. So most importantly, whatever cadre you are in, one of the important exercise that I would recommend you all to do is to identify your stakeholders. Who are the stakeholders? Right? What do you mean by stakeholder? Who is a stakeholder? Somebody who can influence, somebody who is interested, somebody who can stop you, somebody who can motivate you. Anybody can be a stakeholder. So in an organization, in an educational ecosystem, we have the government officials, we have the directors, deans, we have the faculty, parents, students, and most importantly, the community, who are the stakeholders. So these are some of the stakeholders in our profession. So before you do anything, I would recommend you all to do what is called as a stakeholder matrix. So some of you might be familiar with this term, stakeholder matrix, especially if you're in FAIMER. Don't think this is a FAIMER repetitive session, right? So I request you all to do a stakeholder matrix, okay? A, B, C, and D. So you put them in these 4 boxes. In the box A, there is somebody who is high influence and low interest. So if somebody is like that, you keep that person satisfied. You cannot antagonize that person. You have to keep that person satisfied. B, high influence, high interest. You have to manage them closely. C, low influence, but high interest. Consult and keep them informed. Low influence, low interest, minimal effort, right? You just don't have to bother about them. Just keep them informed and maybe not informed also. So you have to map your stakeholders in these 4 boxes. I will tell you who are they in an example that I will give you next. So now there is a big, argument. We don't have to use this word stakeholder. How many of you are aware of it? Stakeholder was originated the term during the colonial rule when they wanted to mark the areas which they invaded. So that is how the word, who had the stakes, right? So that is when this word was coined, stakeholder. So world over, there is a big argument to change the stakeholder to interest holders, right? That's another story altogether. But nevertheless, we still use stakeholder here. The stakeholders can have interest, influence, information, impact, and some of which can be invested also. Investment also they can do. So there will be potential problems which you need to identify who's going to do what. When do you want to involve them, from the beginning or towards the end or in between? And third, what's in it for me is a very common question they will ask. If I want to involve my colleague for some of the workshops or doing something with me, then my colleague would ask, what is in it for me? Are you going to give me authorship? Are you going to give me as a co-PI for the grant, and so on and so forth? So where you want to involve whom, at what stage is something which you have to decide. So let us look at the commitment. So what he can do, a stakeholder can be an enthusiast who will help with you, who will form a good team with you, make it happen for you, or he can be indifferent. He won't help, he won't hurt, he won't volunteer without some prodding. You have to keep on asking, did you give this feedback in your class? Did you give this feedback in your class? Like that. So he may not be, he won't harm you, but he is indifferent. Or he can be openly opposed. No, why should I give feedback for your project or for your work? Why should I do it? So it can be totally opposed. So stakeholder commitment can be of different levels. So let us see one example. So if you want to introduce a feedback form in your department, so it's a very small change. I'm not going something very radical or big. I'm just giving you a very small example. All of us would have gone through this. If I want to introduce a feedback form, so high power, high interest. Who will be the first person who you want to manage closely? The head of the department or a senior faculty mentor whom you are directly under. High power, low interest. You have to keep them satisfied. For example, dean, or if there is a committee, a person who is taking care of the academic affairs. So you keep him satisfied. Low power, high interest, students who are the respondents, or peer faculty can be interested, but they have very low power to influence whatever you're doing. And low power, low interest is you just have to ignore or leave them like that or closely monitor. Administrative or clerical staff who are going to type your feedback form or computer, data entry operator. So these are different types of stakeholders which you will get if I want to introduce a feedback in my own department. And as it progresses, family adoption program, for example. So the last one, if you look at it, the family adoption program, who will be the stakeholder? Community medicine HOD, the faculty coordinators. But more importantly, I have to liaise with the public health officers, the government officials to get permission. They are very important for me. And dean, again, high power, but low interest. Low power and high interest will be again students and community representatives and local health staff. And low power and low interest, the NGO partners, the field workers, if not directly involved. So these are some of the examples how you can map your stakeholders in your day-to-day work. The next term which I'm going to introduce is force field analysis. So nothing comes free. You've seen how to have a stakeholder matrix. Next, you're going to do something called as force field analysis. So as Sir had pointed out in the introduction of app, something that worked in your institution, isn't it? Because everybody felt the app was very free. It just gave the marks immediately. So everybody thought it is free and it is instant. The students are also happy, the management is happy, and the faculty are also happy because you get the marks immediately. So that is something that drives this change. So it is good. People are happy with it. So that is which is the driving force or the positive forces for the change. But there could be restraining forces. So in your own institution, there could be faculty who are not technologically savvy. They don't want to adopt it. என்னப்பா இதெல்லாம் நம்ம அந்த காலத்துல இப்படிதானே போட்டோம் இல்ல பேப்பரை வச்சுதானே போட்டோம் எதுக்கு நீங்க இதெல்லாம் கொண்டு வரீங்க கரெக்டா அந்த மாதிரி ஒரு driving negative forces can be there because they are not technologically savvy or your institute does not have a Wi-Fi enabled campus. So people are like, I have to, use my own mobile data. So on and so forth. So it could be negative forces or it could be a driving force. So from the present state, you want to take it to a desired state, you can do what is called as a force field analysis, right? What worked, what forces will drive the change, and what forces will be restraining the change or protecting or preventing the change. So you need to do this exercise to understand your ecosystem. It could be institutional, it could be administrative, it could be anything within your whatever place where you're working. So that is very important. This was first introduced by a person called Kurt Lewin, and we adopted in many exercises to do a force field analysis before we take any decisions. So this is a template which you can do, a task or goal, which are the driving forces and which are the forces which restrain or stop you from bringing about the change. So that gives you a perspective, and then you can work on the negative forces. Can I change it? If the negative force is no Wi-Fi, is this within my limit to bring in Wi-Fi? Then I will do it. If I have to train the faculty who are not technologically savvy, is it possible? Can I change? Then I will change it. So like that, when you know that forces which are not in favor, you try to change it. If you're not able to do it, then it is out of your control. Okay, you can't do it. So at least you will understand which are the forces can be against your change. So there is another template which I'm going to share, which is called the Grove game plan. So Grove is a company in the US. So they have this game plan. They are more of management company, which has given this template for leaders. So what they say is focus only on the target. Don't think about anything. Focus only on the target, but have a template and map all this in that template. So first and foremost, as I said, who are your team? Who are the stakeholders? What is in it for each of them? And what do I need to do to convince all the stakeholders, right? And then stages and tasks. So how often I have to have a meeting? What is the timeline I'm envisioning to bring about this change? And what are the success factors which I have in my institution? And what are the challenges that can potentially happen to have against this target, prevent me against this reaching this target? So that is the Grove game plan. So this is one of the exercises we give our fellows to in terms of their project. So when FAIMER, we have to have a project. So for that, what we ask our fellows to do is fill this template, have a Grove game plan. Your target is your completion of your project at the end of year 1. That is your target. But when you map all this, you will know which place you have to intervene, which place you can change, and which place there are barriers, and which place there are facilitating factors. So again, this is just a template for guiding you before you take any decisions. So now you have brought in change. You can clap yourself, give a big round of applause for yourself. You have brought in change, but that is not enough. You have to sustain the change. So how we are going to sustain the change? Again, I'm going to introduce one more term, which is called appreciative inquiry. So in a world where we are always finding fault with everything, if you look at social media, if you look at movies, if you look at TV series, everywhere there is only negativity, right? We all talk about in-laws and daughter-in-laws who are always fighting. But nobody projects, a family where there is no fight. Maybe mother-in-law and daughter-in-law get along very well. Nobody projects it, right? But there are such species which do exist. So appreciating what is there is called appreciative inquiry. So this is a very important term for all of us because all of us are challenged. We are, challenged by time. We are challenged by workload. We are challenged by so many things. But nevertheless, we are here because we know there is something good which is happening around us. That's why we are here. So that is what is called appreciative inquiry. It has a 4-step process or 4D model, which is called the discover. First step is discover. Appreciate what is. Don't complain about your institute. Maybe there are 101 reasons to complain, but there is only one reason which you are still there. Why are you still there? Right? So you first discover what is good in your institute. Dream what it can be. If it's within your domain, whether you can bring in any change. Design what it could be, how you are going to bring in the change, and destiny is create what will be. So this is a 4-step model or 4D model we call, which involves discover, dream, design, and destiny for the success of any project or strengths of any institute. So good leader, there can be a good leader. Your institute can have good infrastructure, good team, supportive peers, good salary. It's very close to your house, right? So many good things can be there for you to continue in your institute. So have that first. So discover that first. That is a good thing. Then dream of possibilities. So within my limits, what I can bring about. What all can I change, can I bring about? Visualize it. So visualize the future. That is the dream. Pick a date and where do you want to be? In the next 6 months, where do I want to see my department or where do I want to see my institute? So pick a date, whatever is within your limit. You need not be the health minister or the prime minister or, a big administrative post. You can be a teacher, still you can bring about change. You can, tell yourself, okay, I'm going to be very, competent in the recent AI-based methods, which Dr. Kripakaran highlighted this morning. I'm going to go back and practice. In the next 3 months, I'm going to introduce it in my class. So that could be one thing. So that is a dream. And then design. So what all modules can fit in that? So what all softwares is within my limits? Is it free? Can I afford it? My institute has subscription. So I will design based on this, whatever I want to do. And then the last D is destiny, where events must necessarily happen to achieve the desired future. Implement the plan that will allow the group to reach the desired future, and deployment. So these are the last Ds. So 4D model we usually talk about when we talk about appreciative inquiry. So change is inevitable. You are the change agent. Leadership is crucial for managing change. Each of us have to be leaders to manage this change. Understand your stakeholders, which is very, very important. And two other terms which I spoke about is the force field analysis and the appreciative inquiry. I would like to show you a very small video, a few minutes video, which will give you a different perspective on life. Audio. So we're all here as eagles. So when CBME was started, we were all apprehensive. We didn't want to let go of the old, ideas and ideologies and things like that. But now we are here gathered to talk about the next gen, how we are going to teach. We are here to adapt ourselves to technology and Gen Z and Gen Alpha. So people who change after change will survive. People who change with the change will succeed. People who cause the change will lead. So we are all here as change agents. So we are going to lead. We are going to ensure that the next generation gets a good education and a competent Indian medical graduate as an outcome. So for those of you, there's a little bit of selfish interest here. Sorry about that. If you're interested in FAIMER, the applications are now open. You can look at the website, right? So this is what is there. And to conclude, leadership is nothing new. It has been reported and written in our ancient scripts. I just want to quote one Tirukural and conclude. Thiruvalvar says, "Anjamai ஈகை அறிவூக்கம் இந்நான்கும் எஞ்சாமை வேந்தர் கியல்பு." Do you know the meaning of it? He says, Anjamai. Anjamai means courage. A leader must have the bravery to face the challenges and take decisive actions without fear. Igai means generosity. So we're all here sharing knowledge. So sharing resources and caring for each other. So that is again another quality we are all here, right? To share the knowledge. Ariva means wisdom. Again, a wise leader makes informed decisions, understands situations deeply, and guides others effectively. Last but not the least, Ukam. Ukam means zeal or motivation. We're all motivated. That's why we are all here, gathered for a common cause. So I'm sure we all can be leaders. We all can manage the change in whatever way it comes. And I once again thank the organizers for giving me this opportunity to be here. And nothing more, I'm in pride because I see a lot of our PSG alumni lead the change. Dr. Priscilla, who's our alumni, and so many other PSG alumni are here leading in their own way. So I'm very proud of it. I see a lot of FAIMER fellows also here to come and they have attended this session. So I'm really proud of all of you. Keep up the good work and congratulations. Thank you.
Any questions from the audience or some few questions? Otherwise, madam, you started with an eye opener, ended with the flying colors like an eagle. That was wonderful. I can say, as per, I take it from your words, it is impactful, influential, invested, and impactful lecture you have delivered. Wonderful. Actually, to remind the Tirukural, you reminded of me a Tirukural. Kattrarul kattroar enapaduvar, katrar mun kattra seva solluvar. You are a best example for that. I think all the audience, my co-chairperson also concur with that. Thank you very much for the wonderful lecture.
Thank you, ma'am. To add to the same feathers what Sarah said, usually our professors used to say, we are not here to change anybody. You have to change first, only then you can look on to the others. You have nicely brought it on to that, stating that we are not change agents. Whatever is expected out of others, you have to be the first person. And again, you said with a selfish motive also, we have to train the juniors or the other generations because they are going to be our future doctors. And the way you brought it down and then narrated and ended with a video, it was really mesmerizing, ma'am. Thanks a lot. We'll definitely try to change ourselves and try to manage the other two generations. And instead of walking along with them, we would like to make them move forward and then stand behind them and then observe what they're doing. Thanks a lot for your wonderful session, ma'am.
Thank you, ma'am. Your insights and words will guide us in our profession, ma'am. For sure, we all here in the auditorium and online will really agents, ma'am. And video was really motivating. Thank you, ma'am.